You said that, quote, vaccination is always under attack by a legal system that profits from the failure of most people to understand risk-benefit ratios or public health issues.
I mean that the risk from vaccines, for example, is considerably less than the risk from disease, but people don't necessarily understand that. It's similar to the situation where people may not fly, but they're willing to drive in cars, where the risks are much higher.
When you were a child, what vaccines did you receive?
In childhood, I think it was probably only diphtheria.
Okay. Is it important to get a tetanus vaccine?
Well, it's important if you don't want to get tetanus, yes.
The tetanus vaccine was introduced into routine childhood schedule in the late 1940s, correct?
Yes.
Okay. When the tetanus vaccine was introduced, there were only about 4 cases of tetanus per million people. And that's just the number of cases, not deaths, right?
Yes.
Okay. And you think it's a public health imperative for people to be vaccinated against tetanus, correct?
I think it's the wise thing to do if you don't want to be under risk of getting tetanus.
To prevent something that was a few cases in a million, correct?
Yes. But
do we know whether the tetanus vaccine causes more or less than a few cases of serious adverse reactions after vaccination?
I don't believe it causes a whole lot of serious reactions, no.
The CDC and FDA maintain something called the Vaccine Adverse Events Reporting System, correct?
Yes.
This is a printout of the Vaers data for all adverse reactions reported to tetanus-containing vaccines in the last 10 years. There have been 985 deaths reported
Yes.
to have followed any tetanus-containing vaccine.
Yes.
Okay. That would average to about 98.5 reports of death per year.
Yes.
Over the last 10 years. And it also lists, I'll just last one, 1,256 permanent disabilities reported after tetanus-containing vaccine in the last 10 years, correct?
Yes.
That would be about an average of 125 per
Yes.
year, right?
All physicians are asked to report putative reactions to the Vaers system. So I don't think the Vaers system covers a tiny portion of alleged reactions. I think rather probably most are reported, but I cannot confirm that.
This was a study conducted by Harvard Medical School and the Harvard Pilgrim Healthcare, correct?
Yes.
Okay, and it was done via a grant from an agency within HHS, correct?
Yes.
Do you see where it says fewer than 1% of vaccine adverse events are reported?
Well, yes, I see the statement.
Let's assume that a full 1% of associated adverse events are reported. Wouldn't that take the number of deaths to 98,000 then? That were associated with the vaccine?
I think it's likely that deaths are reported more often than trivial reactions, so I wouldn't be able to extrapolate from that number.
Right.
But, you know, obviously death is more dramatic.
This is the Vaers report for all adverse events, for all vaccines, just since January of 2016. Do you see that?
Yes.
Okay. 751 life-threatening reactions, correct?
Yes.
And that's only since January of 2016, correct?
Yes.
If that's a full 1%, then that would be 75,000 life-threatening reactions that would have been reported, correct?
That's the arithmetic, but not necessarily because of vaccination.
Would you support a study that compared total health outcomes between vaccinated and unvaccinated children, Dr. Plotkin?
If the protocol was scientifically valid, yes, I would support such a study. I don't really put much faith into the Vaers system for a number of reasons, some of which you cited. I take much more I put much more confidence in the vaccine safety data, which are better controlled and which come from institutions that see large numbers of patients.
In terms of the vaccine safety data link, which you just mentioned, that's not available to the public, correct?
Well, I think they publicly report in the scientific literature what they
Independent
find.
researchers want to get access to the VSD. Well,
I don't know what the circumstances are regarding
okay.
access to data. I
Well,
simply don't know.
I won't ask you questions about that if you don't know it.